Yan here, Mayora here. Welcome back sa aking channel. As you can see down in the title down below is pag-uusapan po natin or I will be answering questions related sa ating previous vlog which is pinag ko to siya couple of months ago pa kung bakit ka delayed. So, kasi I was bombarded with a lot of questions sa aking IG at saka sa aking Facebook account. So, as you all know, I'm a full-time nurse. So, hindi ko po masasagot lahat pati sa comment section ng vlog ko na yon. So, I decided to do a vlog about it. So, if you are an old subscriber, thank you for coming back and thank you sa walang sawang suporta. If you're new to my channel, please don't forget to subscribe, hit the notification bell para notified ka po pag may bago pong upload si Mayora. And if may gusto po kayong health vlogs na gusto nyong ipagawa kay Mayora, please leave a comment down below. Shout out pala sa aking subscriber na si Kathleen at sa kanyang kids. So, a shout out at sobrang salamat sa walang sawang panonood sa aking mga vlog. Ayun, so, may kodigo tayo para wala po tayong makalimutan. So, anyway, so bakit nga ba delayed? Bakit ka nga ba delayed? So, ito na po yung pinaka most common questions na kinonsolidate ko po at nilista ko po. So, unang katanungan, Miss Yen, it's been 5 days, 3 days, 28 days, na since the last time na nagka-period po ako. Should I be worried? Kailangan ko na ba pong ma-worried? So, actually, 28 days is considered the standard length of your menstrual cycle. So, ano nga ba yung tinatawag natin na cycle or menstrual cycle? So, ang menstrual cycle is yung from the day 1 ng inyong regla from the first month until the day 1 of your regla the following month. So, bilangin mo yung lahat ng days. That is what you call your menstrual cycle. So, 28 days is usually the standard length of your menstrual cycle. 21 days to 35 days for healthy women. So, this is the average. And it is also to be normal na it's a little bit shorter than 28 days or not less than 21 days and a little bit longer than 35 days. Kasi may nagtatanong din ni, Miss Yan, bakit po ang regla ko last year dumating siya ng 16? Bakit itong month na to dumating siya ng 30? Normal po ba yun? Yes, it is normal. Hindi naman talaga actually on the dot na pareho yung date ng regla mo. Kasi may mga factors din po yan. As long as yung cycle mo is within the duration with average length, it is still considered as normal. Should I be worried kung delayed na ako ng ilang weeks? Well, ang masasabi ko lang, kung wala ka namang milagrong ginawa, you should not be worried. Or if you are not yet ready, if you are active on that side, you know what I mean? So, yeah, you should not be worried unless 3 weeks ka ng delay. Then you started to worry if may ginawa ka or hindi ka pa ready maging buntis. So, I would suggest if 3 weeks ka ng delay, kasi maraming nagtatanong sa akin, when is the best time para mag-pregnancy test? The best time is at least to be on the safe side and for you to have the accurate result. Kasi it's either it's too early ka nag-test, okay? So, it's safe na mag-test ka if 3 weeks ka na. Next question is, I did pregnancy test po and it's negative. And I am 100% na hindi po ako buntis. Bakit po delayed yung period ko? So, as mentioned in my previous vlog, unang-una, most of the reasons na bakit ka delayed is due to stress. See, you might have some maybe stress sa trabaho mo, sobra-sobra na yung pagtatrabaho mo, hagarda versosa ka palagi pagdating mo sa bahay. And then, sickness, nagkasakit ka, knock-on wood, nagka-COVID ka, or simpleng flu or lagnat, or any sickness. So, that can also like be a type of stress which can cause delay ng iyong period. Or you have a traumatic experience. Naghiwalay kayo ng jowa mo. Or niloko ka ng jowa mo. So, that can also like cause delay sa iyong period. Or there is a death in the family. So, knock-on wood again. So, stress affects the brain's hypothalamus. So, ilalagay ko po dito kung sino si hypothalamus. Ayan yung picture niya. So, the hypothalamus sa ating utak, this regulate the hormones for your menstrual period. So, stress, it can affect your hypothalamus, and si Mr. Hypothalamus is the one regulating your menstrual hormones. So, ayun. So, kaya nadidelay yung ating period. 13 years old po ako, Miss Yen. Bago lang po ako karegla. Nagregla lang ako ng 1 month and it's been how many months na hindi po ako nagregla. So, actually, it's also like normal kasi very common to sa mga teenagers natin kasi hindi pa ganun ka-establish ang inyong cycle unless may nangyari na knock on wood. Next is weight issues. It's either sobrang taba ka or underweight. This can also affect sa cycle mo. So, your body mass index must be in between 18 to 25 lamang. It should not be below or it should not be more than 25. So, usually, ang mangyayari, if you are underweight, yung period mo is mag-skip. So, like ngayon, may period ka. Tapos, and then, wala na until forever. Yun. So, pag underweight ka. If overweight naman, magiging irregular yung yung period mo. So, and plus, usually heavy yung period pag medyo mataba ka. So, mahihirapan ka po na mabuntis if you're planning to get pregnant if you are on the mabigat na side. Oo. And then next is, if you do too much exercise as well, like, moderate exercise is also good for us, especially for our circulation. Maganda po yan. And it will give you like happy hormones as well if you do exercise. But too much can affect your hormone levels as well. So, if you are like todo na sa balik-alintog program mo, besh, kasi ikakasal ka na or may upcoming na birthday, na major birthday, and you are on your balik-alintog program, so don't do too much. Just do it moderately lang because too much also can affect your regla. And then, lack of sleep. Lack of sleep is talagang grabe to nakaka-apekto. Hindi nyo lang alam, but it can actually affect your normal period. So, and then if kulang palagi yung tulog natin, magiging irregular yung period mo. Plus, mas severe yung pre-menstrual symptoms natin. So, masakit ang bewang, sobrang masakit ang puson, sobrang sakit ng ulo. And especially now, if you love to travel, yung jet lag as well can cause sleeplessness. Kasi syempre, mag-a-adjust pa yung sleeping pattern mo, yung sleeping cycle mo. So, there is a tendency this can affect your menstrual cycle as well. So, or lalong-lalo na if hindi ka makatulog kasi kakaisip ng jowa mo kasi grenade ka nga. So, yun, that can really affect. And next is hormonal birth control. So, palagi pong may nagtatanong sa akin, I'm taking pills, or kakastart ko lang, kakaumpisa ko lang, bakit irregular yung period ko? Kasi usually, or most sa ating birth control pills, they have lower dose of hormones, okay? And these hormones can cause like thinning of our endometrial lining or yung lining sa ating matris. Nakaka-cause po siya na magiging manipis yung lining. Causing na it's either very like konti-konti, patak-patak lang yung regla mo or to walang regla dahil dyan. And then, if you stop the pills as well, it can take few months also na para maging regular yung period mo. So, this will cause another delay as well. So, that's our number 5. And number 6 is if you are taking medications such as aspirin, ibuprofen, cancer drugs, chemotherapy drugs, high blood pressure medications, antidepressant, and allergy medications. Next, another reason is kung bakit ka delay is after giving birth. So usually, if hindi ka nagpapa-breastfeed, yung regla mo will come back after 6 to 8 weeks kung kailan ka nanganak. But if you are breastfeeding, this can vary. So, sometimes, baby, during the whole time nagpapa-breastfeed ka, is wala talagang regla na lumalabas. Yun. So, yun, that's another reason. And then, next is, if you have underlying health conditions. So, such as if you have thyroid problems, may problema sa goiter, diabetes, may tumor yung pituitary mo, or if you have STDs, or the very common polycystic ovarian syndrome. So, usually, you will have irregular period, may cramps, may bloating ka, at saka you have hormonal disorder. Maraming nagtatanong sa akin, matagal na po na hindi ako nagkakaregla. Okay naman, normal yun sa akin. I would usually suggest na you go magpa-check up sa doktor and have your hormones checked. Kung wala naman dun sa binanggit ko sa previous vlogs ko, yung possible cause na bakit delay ka sa period mo. So another question is, what if it's been months since I last had my period? So actually, kung months na talaga, more than 3 months na, nearly 1 year na, that is what we call amenorrhea or absence of period. So dalawang klase yan. So yung primary, this is for the girls from 16 years old or yung mga younger girls. So this is called the primary amenorrhea. So nag-period lang ng once, after that, within 1 year na, mga teenagers, hindi na siya nagkaregla. So that is primary. And next is secondary amenorrhea. So 6 months or more na walang period, which is like regular naman siya ng previous, that is what we call secondary amenorrhea. So, when to see a doctor? Kailan ba dapat magpa-check up? If you suspect that you are pregnant, so magpa-check up na agad, or after getting a positive pregnancy test. So, again, uulitin ko, when is the best time to have a pregnancy test? Is 3 weeks after na ma-delay. Or if you miss 3 periods na or 3 months in a row na wala kang regla, magpa-check up ka na po. And then, or if your period stopped before the age of 45, as I've said, you have an early menopause, magpa-check up na po. And then, or if you are still having a period or bleeding after 55 years old, so magpa-check up na po. Baka may problema sa matres, and or bleeding in between period or during sa pakikipagtalik, kasi you might have a fibroid or cyst or any issue sa matres mo. So, magpa-check up din. And then, your period, if you notice that your period suddenly changed, biglang nagiging heavy, erratic, at saka post-menopausal bleed, as I've said, after ka tumigil na ng pagre-regla ng 1 taon, and then the following year, nagregla ka uli. So, magpa-check up na din. Next is, you are bleeding while on hormonal replacement therapy or HRT. So, dapat kasi hindi ka magbe-bleed. So, if you had a bleed or regla during this time while you are taking your HRT, you have to have yourself checked with a OB-GYN. So, yun. And, isisingit ko lang, if hindi ka pa nagpa-pap smear, I might as well magpa-pap smear na rin. So, what can I do to make my period more regular, Miss Yen? So, anyway, so, depending on the underlying causes na na-mention ko, sa mga possible na rason kung bakit ka delayed, so, basically, it's plain and simple, you need to have a lifestyle change. So, if you are like, on overweight side, magbawas ng timbang, or if underweight, mag-gain ng more weight. If you are doing too much exercise, do less exercise. And then, if you are eating like mga fatty, salty foods, like eat healthy, well-balanced diet. And then, if you are sleeping late as well, might as well sleep early and have enough rest or sleep. Okay? And then, again, easy on the Balik Alindog program if you're doing exercise. And then, if you are stressed, this is the main reason kung bakit ka po delayed is due to stress. And you know what? This is actually a silent killer. Hindi nyo lang alam. Yeah, so I would suggest to all women out there to mind yourself. Lalong-lalo na mahalin mo yung sarili mo, pahalagahan mo yung sarili mo. Especially like physically, emotionally, mentally. And make things, do things that can make you happy. Like if you love plants, why not being a plantita, di ba? Or if you do cooking, if you love cooking, try to like do cooking or baking or whatever makes you happy. Kasi try to chill din. Huwag masyadong palaging hagardo versosa. Kasi you know what? Life is actually beautiful. So yan lang po. So I hope nasagot ko mostly ng mga katanungan nyo sa ating previous vlogs kung bakit ka delayed. So if you do, please comment down in the section below and hope mabas-bawasan na yung pagsisend nyo sa akin ng private messages kasi nandito na po yung katanungan. And I hope to see you on my next. Have a lovely day. Bye!